Welcome, Dr. Linda Golden. We're going to be having an amazing time with her. She's a biological dentist, and I would like her to talk a little bit about how this experience has been for her and when she started transition from conventional dentistry to a biological, more holistic approach. Thank you for being with us.
You're welcome. It's great to be here. I grew up in a dental office since I'm 12 years old. My dad was a dentist. I went through the traditional, dental school process. I worked with my dad since I'm a little girl and graduated dental school, worked in a very, very fancy high-end practice in Manhattan, right off of Central Park South, with a wonderful cosmetic dentist, completely traditional. Stayed working with my dad until he retired, left that practice, and opened up from scratch on my own practice in 1996 on Long Island in New York. It was a
Very good.
wonderful, yeah, all by myself.
Amazing. That's
Yeah,
great.
so it was me and one of my assistants. Her name is Yudi. Just the two of us with our little charts, and it built into this pretty significant practice. So I had a friend who I was in dental school with who got very sick and he left dental school. But I remembered that he was very alternative and he saved his own life
Wow.
basically after they took half of his colon out and did all this other stuff. And he opened a practice in Manhattan. It was called Dentistry for Health. His name is Dr. Reed Winnick. I have to give him credit. And every time a patient would come in, I'd call him up and say, Reed, what do I do? Reed, what do I do? Reed, what? And he guided me, not just in bills being used, but he showed me that medicine is very important in the development of case planning for dental patients. The oral cavity is very, very connected to all the other organs of the body.
Correct. There is a
From
lot of research now about
yes,
that communication, that link
but
between the mouth and the rest of the body, correct?
20 years ago, I would tell patients they need to see a podiatrist. They thought I was out of my mind.
Okay, can you please explain people a little bit more about why is it important to go see a podiatrist?
Well, it's if you're not balanced and your feet aren't balanced and your jaw isn't balanced, and then if your jaw isn't balanced, you're putting stress and structures on your muscles. If you're not seeing, if I mean, it's even from birth, all of this. So if you don't swallow properly, if you're not breastfeeding properly, if your tongue doesn't work properly, you're not expanding your palate, you're not getting an airway. If you don't get an airway, you can't clean the bacteria from your body. You end up getting allergies and sinus problems. I mean, it's a whole sequela constantly that needs to be addressed. And you can't, I'm going to reiterate, you cannot do it yourself. I
Hmm.
can't do it alone.
Correct.
So I have a team that I'm putting together right now, and I've had a team for many, many years. But the compliance level now it's becoming very, very mainstream. It used to be a niche where I was called like the kooky dentist or the granola girl. And now you see that there's so many biological integrative dentists, um, and you have to really, really be careful because there's a lot that just say that they are.
Mhm. So you have seen how a healthy body is going to have better healing, for example. So when we do, let's talk a little bit about that. How if we have a healthy body, the healing, for example, after an extraction or when we place an implant is going to be completely different if the body is not balanced or if the body is not healthy.
Completely different if it's not prepared, if your immune system isn't boosted, the patient's going to have more pain, more inflammation, have failures. So our process here before I touch a patient for implants especially or extraction slash implants is they need to send me blood work, they need to see a functional medicine, I need to do a scan, I need to balance their occlusion or at least evaluate their occlusion, and so many other tests that need to be done. And when you start those tests, patients think that they're going to come in for a checkup and cleaning. And it's very different here at Golden Dental. Very, very different. I have to get their blood work, their A1C, their LDL, their vitamin D, their K2. They have to be on an immune protocol before I see them. They need to have hygiene done before I see them, before I do the treatments. I need to have certain radiographic interpretations done.
Mhm.
I need to do a 3D scan. I need my X-rays, and a lot of patients are anti-X-ray, which is a mistake.
Oh, yes.
It's a
It's
very big mistake. Yeah, it's like telling a doctor, "Hey, tell me what's wrong, but you can't look at my blood. You can't do any testing, but just tell me what to do."
And
It's
especially
impossible.
especially when we look at an x-ray, just a regular x-ray compared to a CT, it's like you're not seeing the whole picture when you
Right.
have a small little x-ray that is just two-dimensional compared to a
That's
CT.
correct.
Yes,
It's the standard of care has changed, and it's to benefit patients. And a dental CT scan is not like a whole body CT scan.
correct.
It's not as it doesn't have as much radiation, and we have protocols here that will eliminate any scatter radiation. I give them vitamin E and I give them some homeopathics. We use homeopathics here, and the doctor that's the foreman, if you will, you know, for me, if I'm rebuilding somebody's oral care, if I'm rebuilding and eliminating infection, and it's all that's what they're coming for, that's where their pain stems. I want to be the foreman, but I also have doctors, naturopaths, and medicine doctors that send patients to me because they can't get their patient better, and I wonder why. So my pet peeve for the past 20 years, and it's changing now because people see it and these doctors see it, it's changing where they're saying, hey, you need to go to the dentist. I won't get you better. The patients are wasting their money going to naturopaths, chiropractors, functional medicine doctors, if those functional medicine doctors do not look in the patient's mouth.
Correct. Because in a way, I have a firm belief that the oral health is kind of one of the first steps towards health and longevity.
Yeah. Yep. Yep. I study with a guy in Switzerland. His name is Dr. Volz, Dietrich Volz. I'm not sure what his first name is. Oh, it's so bad. Dr. Volz, and I do SDS ceramic implants. And he has a book on longevity and vitamin D. And he's very into longevity.
Yes,
And
yes,
so is Thomas Rao. He
correct.
was
So
all
one of the
about
things
longevity.
that we're big on is the vitamin D levels in our
Yes.
office. What would be your recommendation for an optimal vitamin D level to be able to have good
60 to
results?
80. 60 to 80, and they need to take vitamin K with it. However, there's a little caveat to vitamin K and vitamin D. Vitamin D, if you don't have vitamin K for vitamin with your vitamin D, the vitamin D doesn't know where to go. Okay? But if you have an immune issue, independent of doing an implant or doing an extraction implant, and if you take too much vitamin D, I'm sorry, if you take too much vitamin K, it's a problem. So, and that's a whole systemic, it has to do with your insulin, and there's where the medicine kicks in. And I need that functional doctor to explain the details of that to my patient. So you have to look at the patient's system. And
Mhm.
again, going back to implants and vitamin D, I won't touch a patient unless they're between 60 and 80 with their vitamin D to do an implant.
Correct.
Only place ceramic implants strictly because of the biological response. You get much better integration, and you don't get parasites, viruses, bacteria infiltration in the bone. Our bodies are not supposed to have metals. And you have cavitation sites where extractions are done and it's not cleaned out well. And it's just infiltrated with parasites, bacteria, ranties, it's called. And it's just keeps your immune system so boosted and you can't recover.
Correct. So
Patients
then
have so many illnesses from that.
it is,
And
it is. And then
and
that's
it's
a
not only
communication also with our meridian system, is that correct?
that's correct.
So
It runs the community.
what have you seen, for example, with a patient that you did a procedure and their life
Changed.
changed after that?
I can't tell you, so many. They have more energy. Some of the pain is gone because the inflammation is reduced. You have patients that have had not even from extractions. I mean, I've had like 16, 17-year-old kids where they've had orthodontic intervention, where they have had their bicuspids extracted, and I've sent them for expansion. I don't do it, but an orthodontist does it properly. It's a tricky thing. You don't want to just go anywhere
Yes,
at that age. And their airway is changed. And when their airways is changed, they can breathe. They can play better sports. They can think. They can do better at school. And they can be more successful as business people. They're
correct.
not as sleepy. They're not as tired. Some of them just, I mean, think about mainstream tennis players or athletes that wear orthotic appliances and their eyes improves or their sport improves. You hear about that all the time, you
That
know.
is true.
So
They have
yeah,
enough oxygen in their body, so then their performance is going to be significantly improved.
improve, right. And then another thing that we do is we use a lot of growth factors in our practice.
Oh,
We
okay, good.
we do what's called PRF and IPRF, and we use a lot of ozone in our
Hmm.
practice.
So let's talk a little bit about that PRF and the IPRF so people understand exactly what that is.
What it's doing is it's introducing the cells that will help your body heal. It's strictly for healing. It also we use it as membranes, more natural membranes to keep any kind of to separate the tissue so you don't have infiltration of the wrong kind of tissue up against an implant or a healing site or if you're doing a graft. We use it for plumping up ridges to sort of get a better aesthetic result. And it's a much more natural product and it stimulates your own cells to develop and
Mhm.
it creates healing in a simple way.
And this is something for people that don't know, is something that we draw blood from their body and we
Yeah,
spin it in the
put in a
centrifuge. So we
centrifuge.
get this amazing, pretty much
Membrane.
like stem cells that are going to help build
It's
up
growth factors mostly. I guess you can say stem cells also. We're told to say growth factors.
growth
And we
factors.
also use ozone gas in the practice and ozone water and ozonated saline water to just keep everything very clean.
So let's
This
talk
is
a little bit about something that patients can do at home to help with their health and their oral health, their health in general and oral health. What do you usually recommend and talk with your patients about nutrition?
Okay. So, well, first you have to know how they are. Look. I look at inflammation and if the gum, if the tissue, how the tissue looks. I look if they have mercury in their mouth and if they've had root canals in their mouth. And what I recommend once I take look at the whole picture, I also look at the way they walk. I also look at their adenoids and their tonsils. I'm not saying you need to take them out. I look at their frenum.
Mhm.
So, but when you say, I look at their gait, the way they walk, that has to do with their structure and TMJ, and it also opens up meridians so that they could heal better as well. Patients come in with headaches or sinus pressures or things like that. So I look at all that and then I give them my recommendations to take out the mercury safely. And I show patients that if they have a root canal on a premolar or a molar, their body is fighting that root canal and they're not addressing a meridian like their breast. Tooth number 19 is blood and vascular systems. And then I'll look at their bacteria, I look at their nitric oxide, look at their pH, and then I give my recommendations. If their pH is very acidic, I'll recommend that they use some lemon water, not lemon juice, but lemon oil, or I'll use alkaline or baking soda, something to reduce the acidity of their mouth, not their gut.
Okay,
Their
so
gut
let's
is
let's
really
go let's
acidic.
go to that. So if they're acidic, you recommend lemon water,
I
even though
like it,
it's acidic.
yeah, but the oil from the rind of the lemon, it's put into an oil and you do 4 drops in the morning. You do not sip it all day long. You just do it first thing or at one sitting. And you drink a little bit of 6 ounces and 4 drops of essential oil.
Oh, an essential oil. Okay.
Yeah, it's got to be essential oil or something that'll reduce their oral acidity. I do the lemon water or alkaline, or I just tell them to rinse with baking soda for goodness sake, but not to brush with it every day because it's too abrasive.
Correct.
I also, if they have a lot of spirochetes, I tell them that they need to look at that systemically, but to handle that in the mouth, I tell them that they need to bring their spouse in. They need to not kiss their children or use the same spoons. They need to look at are they, kissing their dog, dogs and stuff like that. So you need to look at the where the spirochetes are coming from. And if they do have spirochetes, I give them a rinse. I use different rinses. I use a dental herb or I use Stella
The still life.
Life, yeah.
Mhm.
What else do I do? I
And
have
then
a
just to explain a little bit about the spirochetes. The spirochetes is a type of bacteria that we don't really want in our mouth. Is a high risk bacteria for periodontal disease. Let's give people some little like pearls of knowledge that you will recommend everybody.
water pick, water pick, water pick. Have a good diet, whole foods, and only whole foods. Stay away from preservatives. Exercise and sleep. You start there.
It's
You
great.
start there.
That's a great advice. Yes.
Hydrate, hydrate, hydrate. Intermittent fasting is wonderful. Now, these are not dental pearls. These are life pearls.
That benefit
Intermittent
the oral
fasting,
health.
it will benefit your oral health. And whatever benefits your oral health will benefit your overall health. And then anything that benefits your overall health will benefit your emotional happiness, I believe.
I agree. I
I
agree
believe.
100%. Yes. Yes.
I'm not saying you can't have a chocolate kiss once in a blue moon, but you need to eat only whole foods. You need to sleep when the sun goes down and wake up when the sun comes up. Get to know your rhythm. Sleep is so important, and your gut microbiome.
That
So,
is true. Thank you so much. I've heard that you're not depressed, you're just having lack of sleep. A lot of
hmm
people, it just affects their mental state.
yep. And they get irritable. If you eat the wrong foods, you get irritable. If you don't get enough sleep, you get irritable. You got to reduce your stress. And I think that the reduction of stress is exercise. It releases endorphins, dopamine, serotonin, and then once you have that core, then you can do anything.
Yes,
But if you don't have that, everything's going to be an annoyance, and you won't brush, and you won't water pick, and you won't eat right, and it becomes this perpetual spiral. So, you know, that's where I think it needs to begin. If
that is,
anybody wants to start somewhere, that's where you should start.
yes,
Then get into a dentist, get your blood work, get your health under control. You'll be better for it.
that is so true. Well, how can people find you?
I practice in New York on Long Island, Manhasset. We have a website. It's goldensmile.com. I have a partner. She's lovely. Her name is Dr. Batul Rizvi. She's a wonderful surgeon who does the more complex surgeries in my office. And we have another doctor. Her name is Dr. Kern, who I'm actually training to understand and deliver biological holistic dentistry. She came from the traditional world, and we're trying, we need help.
This is
You know,
amazing. Yeah, because I feel like everybody, every single dentist should be having a holistic approach because this should be the standard of care.
we need to share our knowledge also with the generation that isn't on board with this. And if they don't want to be, don't bother, of course. But if they're interested, we need to teach them.
Yes.
People like me and we're not going to be around all the time. The younger generation, like you, I'm so glad are around. And in my biological community, there's so many young doctors and dentists that are really trying to learn this, which I'm very, very grateful for.
Well, thank you so much. Thank you for all this information that is just very important for people to know.
Really, thanks for
Thank you.
asking.
Thank you.